So my name is Logan Tinson. I'm the PGY1 Pharmacy Program Director at the Benefis Hospitals in Great Falls, Montana. So I think this is probably the number one thing I want potential applicants to know about our residency program. We are located in north central Montana, and we are the largest health system in north central Montana. We have a very diverse patient population to give residents a opportunity to see a bunch of different things from neonatal through end-of-life care. We have a large catchment area of roughly 13 Montana counties, and so we go and get a lot of patients and bring them back to the hospital and keep them here, and we don't necessarily ship those patients out, so we keep those patients here. So there's a lot of diverse patient opportunity for residents. So some of the personal qualities best suited for potential applicants to our program: we prefer a resident that is hardworking, driven, and autonomous. Those are big qualities that we're looking for in our residents. How would I describe the pharmacy atmosphere? I would think that the atmosphere is very collaborative. We are a collaborative group, so our main focus is our patients, and so taking care of our patients is our number one priority. So we make sure that we always collaborate with each other and double check things and make sure that patient safety and taking care of our patients is very important to us. As an RPD, I would say the main goals that I want the residents to achieve by the end of our program is I want them to be strong, autonomous residents that can practice anywhere, whether that's move into a second year residency or if that's moving into practice and being able to practice at a academic medical center or practice in a critical access hospital. The goal of our residency program is to make sure we have a good, well-rounded resident that can practice anywhere. So the roles that some of our pharmacists play in our institution, we have a hybrid model of a centralized and decentralized unit-based model. The pharmacists are highly integrated into the healthcare team in the decentralized as well as the centralized models. So we have pharmacists throughout the hospital that are part of that care team that are rounding with physicians, nurses, and other healthcare professionals to provide the best patient care. Past residents, after they have graduated from our program, a couple have gone on to do PGY2 residencies or second year residencies. One has specialized in oncology and one in pediatric infectious disease. Other residents have been able to become employees of Benefis, and some have gone on to just enter the workforce after graduating our program. Some of the project requirements of our program is we require a longitudinal major project, as well as several other mini projects like drug utilization evaluations, as well as having topic discussions and things like that. We also expect residents to help lead our robust antimicrobial stewardship program. Work-life balance is important for our program and for our residents, so we keep a close eye on our residents and make sure that they are able to maintain an appropriate work-life balance. Staffing requirements for the residency program is every third weekend, as well as some staffing requirements throughout the year if needed, because we're short-staffed. There are lots of leadership opportunities through our hospital. We expect residents to mentor and precept students that we have on site. They can have the opportunity to lead our pharmacy and therapeutics committee, med safety committees, and other committees throughout the hospital. They also have an opportunity to become the resident liaison for the state through the Montana Pharmacy Association. We also require an education and teaching certificate, so teaching is very important to us and leads to leadership opportunities for the resident.